Good morning, everyone. Welcome to our series at the Mariposa Community Health Center here in Nogales, Arizona. These are sessions we conduct to educate our community and offer guidance as to various types of medical issues. My name is Eladio Pereira. I am the Chief Medical Officer of the Mariposa Community Health Center. And with me is Dr. Phil Williams, Associate Medical Director and Pediatrician. Welcome, Dr. Williams.
Thank you, Dr. Pereira.
Great.
Always a pleasure.
Thank you. So today, we thought we speak a little bit about vaccines as we enter the winter. We'll touch on that. But before we do that, I want to remind our viewers and audience that we search through trusted sources of medical information, not just our own medical schools and training programs, but also trusted sources within the U.S., including the Mayo Clinic, of course, the Center for Disease Control and Prevention, Johns Hopkins, and others. So the information we will share with you today comes from those sources. And sometimes we'll share our own clinical experience for many years in the areas of medicine and vaccinology. After that initial comment, I'd like to touch a little bit on the history. I think sometimes it's really important to go back to the history of medicine. We learn a lot from our colleagues who created a lot of the vehicles, a lot of the medical innovations that were created many years ago. And at the moment, sometimes we feel comfortable because those diseases no longer cause problems in our population. There will always be emerging infectious diseases that we discover, that we learn. But there are some diseases that have been eradicated. And of course, the one that we can think of is smallpox. We no longer see smallpox, a very serious illness characterized by high fever, profound muscle symptoms, and of course a very distinctive rash in the face and the rest of the body that in some cases left a lot of scar. In those days, the mortality rate was very, very high, close to 30%. But we're very fortunate that those doctors ahead of us discovered those vaccines that were very useful. Of course, with the smallpox vaccine, it was Dr. Edward Jenner who vaccinated his child against smallpox in 1796, and he published his work a couple of years later. And continued progress was made. The first smallpox vaccination occurred in the U.S. In 1796. And progress continued, and it was around 1980 when the WHO declared smallpox eradicated from the world. We know that during the 20th century, around 300 million people die of smallpox. We can just imagine what mortality would be without that vaccine. So we're very fortunate to enjoy a smallpox-free society at the moment. There are other vaccines that became very effective. Dr. Williams, you want to talk about the rabies vaccine?
No, of course. It was almost a little over 100 years later that Louis Pasteur developed essentially the first rabies vaccine. So what he did is that he essentially inoculated a young boy that was bit by a rabid dog. Of course, rabies still to this day causes significant issues if left untreated. Can even lead to respiratory failure, death. Actually, in medical school, I remember I helped take care of, it was the first human case of rabies in 30 years in Indiana. So it was a little girl that was bit by a rabid bat. And, again, if left untreated without vaccines, it caused significant issues. Unfortunately, that little girl, she actually passed away. We, diagnosed it, when she was already in respiratory failure, and did an experimental protocol out of Wisconsin. But unfortunately, she passed away. So it still is a huge issue. But the vaccines work.
Absolutely. And we know that rabies was uniformly fatal prior to the vaccine. Now we have this vaccine that we can use preventively, pre-exposure prophylaxis. We also can administer the vaccine post-exposure, and it is very, very effective. So very fortunate to have that available to us. The other vaccine that sometimes we don't remember is polio, because we don't see it any longer. Polio is a virus that can attack humans, and it can lead to significant issues, mostly in the nervous system. It attacks our muscles of respiration. It can also attack other muscles and nerves in the body, I should say. And we still see those patients who have the residuals of polio, where they have asymmetric flaccid paralysis on one leg, the result of the illness. Back then, respiratory failure was fairly common, and at that time, the iron lung were available, those lungs that expanded the chest to assist individuals with breathing. And polio vaccination have been extremely helpful, and it was in 1994 that it was declared eliminated in North and South America. So we have plenty of examples where the history shows how effective vaccines are. Sometimes we lower our guard, we don't see those illnesses anymore. But we have a lot of vaccines available in our toolbox to prevent diseases. And there's one in particular that I'm going to ask Dr. Williams to speak about, and that's the HPV vaccine, or the human papillomavirus vaccine that is now available. Dr. Williams, tell us about the HPV vaccine.
Of course. So, HPV, just like you said, stands for human papillomavirus. And there's, I think, almost around 200 types of HPV. So they're different, we call it serotypes. Some of those specifically can cause and have been linked to cancers. Specifically, serotypes 16 and 18 are the most commonly associated with cancers. And, everyone has classically heard of cervical cancer as one of the common cancers, but it's not just cervical cancers in women. Men and women can have mouth cancers. You can have cancers of the esophagus, of the mouth, of the tonsils. And again, it causes significant issues, but it is preventable. So the HPV vaccine you can give to kids, and now also adults, but you can give to kids as young as 9 years old. And that's actually what we promote at Mariposa. We promote giving it, as young as possible. HPV, of course, is transmitted via sexual activity. And the point is to vaccinate, far before that becomes, a thought or an issue. So we recommend vaccinating early. It's a series of vaccines. Depending on your age, it's either 2 or 3. But again, highly effective, reduces the rate, more than the 90%.
It is considered a cancer prevention vaccine. It does prevent the onset of these cancers. As Dr. Williams said, mouth, anus, cervical, and other types of cancer. There's another vaccine that prevents cancer. That's the hepatitis B vaccine. When hepatitis B becomes chronic in certain populations, the liver can become scarred. The scarred tissue can lead to an increased risk of cancer delivery. So hepatitis vaccine is also considered a cancer prevention vaccine. So we ask our viewers to check with their doctors, certainly in teens, about the importance of being vaccinated. And of course, our message is to the parents to make sure they ask their pediatrician about the HPV vaccine. It can also be given in adults up to age 45 through what we call shared decision making. And so we do promote HPV vaccine. And then there are other vaccines now that the winter is upon us, to make sure that we reduce the risk of respiratory infections. And Dr. Williams, what are those vaccines?
Of course. So one is the influenza vaccine. The influenza vaccine can be given as early as age 6 months. And again, it's highly effective. Flu causes issues in kids and adults, specifically those that are young and then those that are old. Classic symptoms, of course, are, myalgias or muscle pain, can cause fever. My son actually went this morning, had flu A, so he had fever yesterday and today, fever 102, so it definitely can cause issues. And like I said, again, there are vaccines for it. Other vaccines, of course, for respiratory illnesses is the RSV vaccine. We've talked about it on this show before, but there are different options now. For kids, it's called a monoclonal antibody. So we essentially use it similar to a vaccine, but we can also give that to young kids. And it works. It's supposed to be given to kids under the age of 8 months. Really can be given within the first week of life. Can reduce hospitalizations by 90%.
We also have the RSV for adults, 60 and above. So we do recommend that. And certainly, as you mentioned, the influenza vaccine. A quick reminder that influenza is a virus that can cause complications, various of them, including pneumonia. But once you recover, you can also develop post-influenza bacterial pneumonia, and there are other complications that come a little later, including cardiovascular disease. So influenza can cause problems not just with the initial infection, but also the post-infection issues that can happen. And then a quick reminder about COVID vaccine. Check with your doctor about getting the new vaccine. Of course, pneumonia vaccine reduces the risk of pneumococcal pneumonia, which is another bacteria. It is the most common cause of bacterial pneumonia in this country. There are a number available, and your doctor can guide you to get the correct pneumonia vaccine. So we reviewed today trusted sources of information of our institutions in the U.S., some of the history of vaccinology, and a reminder that we're very fortunate to be free of certain diseases that kill millions of people several hundred years ago. We discussed the HPV vaccine and then reminded the audience or viewers about the COVID vaccine, influenza vaccine, RSV, and pneumonia. I hope this has been useful. Thank you very much. I'm Eladio Pereira, the Chief Medical Officer at Mariposa Health Center in Nogales. With me, Dr. Phil Williams. Thank you, Dr. Williams. And thank you to Edgardo and the production group at Mariposa for making this possible. We'll see you the next time. Thank you for your support. I hope this has been useful. Have a great day. Thank you.